Hello, my name is Dr. Elizabeth Donaldson, and I'm delighted to be presenting today. I apologize that I can't be there in person, but thank you to Dr. Penny for convening this wonderful symposium, and I'm delighted to take part. So hopefully this technology will work smoothly and you can see me giving this presentation and my slides as well. And then hopefully, if all goes well, I'll be available via Skype for participation in the discussion section at the end. So my presentation's on advocating for sugar-sweetened beverage taxation, a case study of Mexico. And first, a disclaimer, the presentation reflects the views of me, the author, and should not be construed to represent the U.S. Food and Drug Administration's views or policies. The work I'm presenting here was conducted while I completed my dissertation, my doctoral work, at the Johns Hopkins Bloomberg School of Public Health. And I'm looking at the screen and trying to look at the camera too, so apologies for the little confusing camera angle as well. So in this presentation, I'm going to share a case study about the passage of the sugary drink tax in Mexico. I'll highlight what worked in terms of policy advocacy, as well as what didn't work. And just to give you some context of how I got involved in this work, I was wrapping up my dissertation research on factors that helped or hurt sugary drink policies in the United States, and there weren't successful sugar-sweetened beverage taxes that had passed at the time. This was in 2015 in the US, and when my advisor told me of an opportunity to do a case study on the work of advocates leading up to Mexico's passage of the sugary drink tax, I really jumped at the chance because they had obviously done some great work to get the tax passed and had some really interesting perspectives that I would have been unable to get as just an outsider looking in without talking to them. So pictured here is the report that came out of this work that I'll talk to you about today. And this report, if you're interested in reading it in its entirety, is available on the Johns Hopkins Bloomberg School of Public Health website. So like a growing number of countries, Mexico at the time in 2015 and still is facing the dual epidemics of diabetes and obesity. At the time, again in 2015 when this work was conducted, 1 in 3 children in Mexico and 70% of adults were overweight or obese, and sugary drink consumption continues to be a key driver of the obesity and diabetes epidemics in Mexico, with over 70% of adults drinking at least 1 full-calorie soda a day. So pictured here, well, first in October of 2013, Mexico was one of the first countries to pass a national tax on sugary drinks. And depicted here is one of the communication materials from the campaign leading up to the tax's passage, and it illustrates the amount of sugar in popular Mexican soda brands. So in October of 2013, a specific excise tax of 1 peso per liter of sugary drinks was passed by the Mexican legislature. At the time, it was about 1 peso translated to about 8 cents in dollars, US dollars. The legislation went into effect on January 1st of 2014 and increased the average price of a liter of soda by about 10%. The tax is levied on concentrates, powdered syrups, essences, or flavor extracts added to the beverages, so therefore it applies to any beverage with added sugar, syrups, powders, or other caloric sweeteners that are added. So this would include soft drinks, energy drinks, bottled teas and coffees, as well as fruit juices and fruit-flavored drinks with added sugar. I'll tell you a little bit about the methods of this case study. In order to study the work of advocates leading up to the passage of Mexico's sugary drink tax, I conducted a qualitative case study to learn what worked and what didn't work in terms of policy advocacy. So I went on a whirlwind trip to Mexico City in early January of 2015 to interview about 20 individuals involved in various ways in promoting and passage of the tax. So the individuals I talked to were really incredible because of their diverse and informed perspectives, as well as just their general enthusiasm and wanting to talk about the tax and their experience, because again, this was in 2015, the tax had passed in 2014, and they had been involved in advocating for the tax years before that. So I talked to advocates who are part of a broad coalition of human rights organizations, water rights, public health, consumer rights groups. I talked to groups adept at political strategy and lobbying, more political think tank type groups. I talked to senators and Ministry of Finance representatives. I talked to physicians and journalists. And the photos pictured here are the only ones I took of beautiful Mexico City's historic center as I was traveling between interviews. So in terms of findings of the case study, I did a document review as well as conducting those key informant interviews, and the interviewees were selected through a convenient sample and kind of snowball sampling, starting with the advocates involved and kind of moving from there. And some of the advocates provided documents like media strategy documents or other documents to review. In addition, because I don't speak Spanish, unfortunately, I had simultaneous translation, and so in my ear there was a translator talking to me and translating for me and the people I was interviewing. So I had transcripts from that I reviewed, and then I also took notes during the interview, and then debriefed after each interview. So I looked across all of these materials and am pulling together the transcripts and notes from the interview and the document review. I organized my findings around three key elements of the successful passage of Mexico's sugary drink tax campaign, and they're pictured here: advocacy, science, and context. So first, at the center and core of the success was a strong policy advocacy campaign, and that includes strong media advocacy work. So the organizations involved that I talked to had extensive backgrounds in media advocacy and political strategy. So in speaking with individuals, I could see and hear their passion for the issue and how they were able to connect with a broad array of stakeholders. The advocates formed a coalition of various diverse groups, focused first in promoting the tax, but it was really one of several issues that they came together around, ultimately working to reduce and prevent obesity and diabetes in Mexico. Policy advocacy like that I explored in Mexico is defined as a strategic effort to promote a policy change. So, which in Mexico, and I think often includes a media advocacy piece, both paid and earned media, as well as other components, including coalition building. And as I'll show in Mexico, the use of scientific evidence and knowledge of the political process to meet with key decision makers at critical times played into that broader strategy. So this slide illustrates the member organizations of the coalitions and the issues that they convened around, including the sugary drink tax, which is listed as fiscal measures on this list in orange. But you can see in total the coalition convened around a shared policy agenda with 8 goals listed here. And as I mentioned, there's a broad array of coalition members. You can see their organization titles listed here. So coalition building can be one type of policy advocacy strategy, and it's intended to build a strong base of supporters. Of course, that base of supporters can then pool financial and other resources, raise the visibility of the issue to propose solutions in the media, and also raise the issue with the public and key stakeholders that they're tapped into. And third, create greater leverage for engagement with decision makers. So that was a key piece. So let's talk about some of the policy advocacy strategies used in Mexico. Aside from coalition building, one big piece, as I mentioned, was media advocacy. In this case study, I considered media advocacy as one type of policy advocacy, and it could take shape in social, earned, paid, owned, or opinion media. And I've depicted through icons here what each of those kind of entails. So there was a paid media campaign to demonstrate the harms of sugary drinks, and the campaign was called the 12 Spoonfuls of Sugar campaign. It highlighted the amount of sugar in soda and linked soda consumption specifically to diabetes. So there were print, video, radio ads, and billboard ads of this campaign, as you can see here. So here's another poster from the media campaign. First came obesity, then diabetes. Graphic images, like the one illustrated here, illustrate the effects of diabetes, including amputations, blindness, and death in this series of campaign materials. So the messages emphasized the association between soda and diabetes and noted the need for sugary drink regulation in a variety of ways. The fiscal measures, they were also talking about marketing that targeted children and improving food labeling. So diabetes is such an epidemic in Mexico as in other places of the world now, and depending on what the person's access to care was like, diabetes can have severe consequences. And so it's a very salient and critical issue, very wide-reaching, obviously in terms of the prevalence in Mexico. So the advocates wanted to highlight that it was associated with sugary drinks to make that connection to a very difficult and terrible health condition that many in Mexico or their family members were well aware of the consequences of. So the other type of media advocacy, earned media, was also used. The advocates in Mexico noted that earned media is often fostered by being accessible to the media, by building relationships with the journalists, and being available to respond when media inquiries come in regarding the issue or proposed solutions. And so, as I said, my way to select interviewees for this case study was through a convenient sample, kind of snowball sampling. And I remember being surprised when the advocate that initially I was put in touch with connected me as well with journalists that were still, a year later, very interested in talking about kind of their role and how they were working to cover the various campaign aspects or changes in the legislature that came up as this tax discussion evolved. So I thought that was interesting. So in addition to earned and paid media, another policy advocacy strategy that they used was reaching out to decision makers, including legislators. So they met with key legislative committees and executive offices like the Ministry of Health and Finance. And this policy packet says on the left, millions of people in Mexico with problems of obesity and overweight need us. Let's make sure they're not even more. And on the right side, it says there's a lot of pressure to put a tax on sugar-sweetened beverages. So in addition to a strong advocacy campaign, the second component that advocates really highlighted for me was their ability to use scientific evidence. So the individuals involved understood the scientific evidence. They relied on evidence to guide message development for media campaigns and to use key facts and information for any kind of interaction they had with policymakers. They released, there was the release of this academic peer-reviewed publication, Obesity in Mexico, Recommendation for State Policy, and the advocates in this case ensured media coverage of it and distributed this report to key stakeholders. In addition, the National Institutes of Public Health, in collaboration with other academic institutions, published key analyses using nationally representative data about the high consumption of sugary drinks and health implications. So aside from peer-reviewed evidence that they were able to use, the advocates also had physicians, public health professionals from within Mexico, the US, and elsewhere working with them that could share stories, both in terms of kind of scientific evidence, but also anecdotes from physicians that they were treating children as they were coming in. So I actually interviewed one endocrinologist who talked about seeing patients with endocrine changes so much younger in the past couple of years than he had ever dealt with in his career, and shared an anecdote that he heard from many of the parents in one rural area he had worked in, that they often received soda and gave it to their children in bottles as young as 4 months old because in this case, Coca-Cola was a status symbol in some rural areas and is considered safer to drink than the water by some of the residents. And so the ability to use both evidence and anecdotes was really useful for the advocates and was also powerful, as I saw in kind of talking to physicians, part of this case study. So the third key element of the successful strategy in Mexico was that the advocates knew the political context. They had savviness to know when to meet with and whom to meet with, and knowing how to frame the issue for each stakeholder. And timing was obviously key for the political context piece. Advocates in Mexico developed a strategy that made use of political timing of proposed fiscal reforms and the annual budget process at the time. So they knew that the incoming president at the time was going to propose fiscal measures on food and medicine, and they were able to capitalize on that to raise the issue. My three big takeaways from those that worked to pass the sugary drink tax were: first, partnerships and coalitions were critical. The coalition of advocates, academics, political think tanks were all important and combined their strengths in compiling and both scientific evidence as well as kind of evidence of how to conduct excellent media campaigns. And here you can see the types of partners that were involved as some of their work, as well as some of their work that was done together or to complement the work of the other partners. So together, an overall effort to advocate for the sugary drink tax contributed to the successful policy change. So you can see what the advocacy organizations did, what the academic researchers did, and as well as what I'm calling the more lobbying organizations, the political think tank groups. Second, the passage of the tax didn't happen overnight. The process wasn't smooth. As you can imagine, years of work led up to the effort directly prior to the advocacy campaign. The process wasn't easy or quick. It faced continued opposition from the beverage industry, That was the main opponent, in this case in Mexico. And here are some examples of campaigns and materials that oppose the tax directly or express the industry's perspective. So here it says no to the Bloomberg tax. Bloomberg Philanthropies, the former mayor of New York, was funding some work of one of the advocates in Mexico, and so that's what they were trying to highlight here, kind of outsiders coming in to dictate what was going on in Mexico. And here it says know yourself, get active, get balanced, play more for many years. And here in the bottom it says 140 calories per dance, 20 minutes with your friends. So the advocates prepared for the opposition and in some cases chose to respond, and in others chose to just stay on their message about the benefits of the tax without acknowledging some of the opposition's points. So they were very strategic in how and when they responded to the opposition's media. When the tax did pass, there was impact observed in the first year of a 6% decrease in consumption of the drinks that were taxed. Since then, obviously, more time has passed and more research has been done on what has happened in Mexico, and I want you to look that up. And despite the tax's successful passage and initial positive public health impact, the third and final takeaway from my case study was that the advocates didn't see their work as done. It wasn't that the tax was passed and that was it. When I spoke to them in 2015, a year after implementation of the tax, they were very focused on enforcement. The passage or enactment of the law was really only the first step for them, and the advocates in Mexico had intended for the tax revenue from the tax to fund clean water in schools and public spaces. However, that language wasn't retained, so the advocates I spoke to for this case study were continuing to pursue using the funds for clean water. And as I noted before, they had a comprehensive approach plan to obesity and diabetes prevention in the country. For example, a ban on child-targeted marketing. So they continued to work on that. And this slide here depicts another ad targeting senators that they use that says the obesity epidemic is transmitted by soda lobbyists. Senators, have you let yourselves get bitten? Protect our health with the sugar-sweetened beverage tax. So thank you so much for your time. Here is my contact information. I'll be happy to answer your questions during the discussion section, or you can reach out to me via email. Thank you.